Hello and welcome to the Health and Wellness Lecture Series. My name is Dr. Jason Phillips. I'm a urologist here in Oceanside, California. And today I'll be discussing a topic that's near and dear to my heart, BPH, or benign prostatic hyperplasia, and reviewing its etiology, its symptoms, and treatments for it. Once again, my name is Dr. Jason Phillips. I work in Oceanside, California at Urology San Diego. I'm a diplomat for the American Board of Urology and a fellow for the American College of Surgeons. I'm Chief of Urology at Tri-City Medical Center and a staff physician and surgeon at Scripps Memorial Hospital in Encinitas and Palomar Medical Center. Goals for today are to understand BPH and how it affects a man's quality of life, understand the treatment options, and hopefully leave this lecture knowing your options. So what is the prostate? The prostate is a walnut-sized gland at the base of the male bladder. It surrounds the urethra like a donut and produces fluid that transports sperm during ejaculation. So what is BPH? Well, it stands for benign, non-cancerous prostate or prostatic hyperplasia, abnormal growth, localized of cells. So what happens to the prostate over time? Well, it's normal for men in the 20s, and over time it grows. And as the prostate enlarges, it can put pressure on the urethra. If you imagine that the prostate is like a donut, it grows on the outside, but it also grows on the inside, restricting and cutting off the tunnel or the urethra that is inside of the donut hole. It can cause urinary problems. And it's important to note, the size of the prostate does not always correlate with the degree of obstruction or the degree of urinary symptoms. This schematic shows a normal bladder, which is smooth-walled, elastic, compliant, able to hold and store urine, with a prostate with a channel in the middle that's open. Yet the other schematic demonstrates a thick-walled bladder, a whorled appearance of the bladder with hypertrophied muscle. It can't expand all the way, the nerves are overactive, and that's due to the prostate obstructing. And the prostate itself has that whorled appearance where it has abnormal growths or BPH nodules, and that channel on the inside is much more narrow. Urologists look inside the urethra with a telescoping camera called the cystoscope. And here are some cystoscopic images which show what the urethra looks like. And you can see with a normal prostate, via cystoscopy, the prostate is open and a channel can be seen from the edge of the prostate all the way into the bladder. The middle picture shows an obstructing prostate from BPH, but it's not completely obstructing, it's partially obstructing. And with severe BPH, that channel is compressed. And despite pushing water through the cystoscope, you can see that there are kissing lateral lobes and the urine flow just can't go quite through it. So what are the symptoms of BPH? They're categorized into two broad categories, obstructive and irritative. The obstructive symptoms, weak stream, hesitancy, interrupted stream, hard to get it going. The irritative symptoms are the ones that people most complain about: urgency, daytime frequency, nocturia, and even some painful urination and incomplete emptying. Often that affects quality of life, and so what we see as urologists are men coming in suffering from BPH, and they experience a reduction in their ability to travel and enjoy their lives. Their leisure activities are interrupted. They're often looking for the bathroom stalls no matter where they're going, and they can have disrupted sleep patterns, getting up multiple times at night, affecting both their health and their significant other's health. So with BPH, what's the end game or the end result? If men can't urinate and that prostate becomes larger and larger, the prostate can constrict or cut off the flow so that the bladder can't empty. If the bladder can't empty, they go into something called urinary retention. It's very painful. Typically, men will go to the emergency room or to their doctor if this happens. It can also be silent and non-painful. And what happens from there is if the urine can't get out, it has to go somewhere. So it goes up to the kidneys and can cause kidney failure. It's nice to know that you're not alone. Enlarged prostate affects more than 38 million men. As the prostate continues to grow from the time you're a teenager, and it will continue to grow for the rest of your life. And typically, for men in their 60s, 70% of the men will suffer from an enlarged prostate, and that number only increases over time, and you'll see 90% of men suffering from enlarged prostate in their 80s and 90s. And of the men with BPH, approximately half are affected to the point where their quality of life and their lifestyle is significantly affected and they need to seek treatment. So what is the workup for men and how is it diagnosed? Well, typically through history and a questionnaire as well as physical exam. A PSA and the prostate digital rectal exam is used to rule out cancer, while an ultrasound is utilized to evaluate the size of the prostate as well as the residual urine assessment, how much urine is left in the bladder after trying to empty. If further examination is needed, cystoscopy or the camera that goes through the urethra to evaluate the inside of the prostate and the bladder is utilized. And the one question that I ask every man is, how much bother and how much are you affected and how is your quality of life affected? If the bother is low, we often observe the symptoms. If the bother is high, well, let's get a treatment plan. So what are the treatments for the prostate? Well, listed on this screen, we have watchful waiting, phytotherapy or over-the-counter medications, prescription medications, prostate heating or ablative procedures, transurethral resection of the prostate or removal of tissue via TURP or photovaporization of the prostate, simple prostatectomy for large prostates, and the Urolift system. But it's important to know that different treatments are appropriate for different patients, depending on their symptoms, size of the prostate, and anatomy of the prostate. When we look at watchful waiting, advantages are clear. There's no surgery, there's no prescription medications. It's somewhat inexpensive, but it may not treat the symptoms. This is always a good first step if there's some new urinary symptoms, but if they persist, recommend getting evaluated. Phytotherapy or over-the-counter medications such as saw palmetto or beta-sitosterol have the advantage of no surgery. They're relatively inexpensive. There's no prescription medications and the side effect profile are minimal to none. The disadvantages, well, the CAMUS trial, which was a randomized controlled trial, didn't show any statistical benefit of these medications. However, I have patients that come in every day that find some benefit from saw palmetto or one of the other medications. I recommend that there is no problem trying these medications, but often they are not sufficient enough. So what are the medications? Well, medications fall into three broad categories. Alpha blockers such as Flomax, 5-alpha reductase inhibitors such as finasteride or dutasteride, or phosphodiesterase inhibitors such as a low-dose daily Cialis. Advantages, you can start and stop the medication whenever you want. There's no surgery required, but it may or may not provide sufficient relief, and there are side effects for every medication. Some of the side effects that I hear about often are with the alpha blockers, retrograde ejaculation, or having something we call orthostatic hypotension. Getting up too quickly and the arteries can't snap quite tight enough, quickly enough, and people get lightheaded. With some of the 5-alpha reductase inhibitors, side effects include loss of libido, some issues with erection, breast tenderness, and breast enlargement. And with Cialis, men often complain of some congestion or some back pain. But you can start and stop these medications and they're a good first-line treatment. For men who aren't able to control their symptoms with medications, there are a variety of procedures that are available. If we look at prostate heating procedures, these are ablative in-office procedures that can be performed. And that includes microwave, needle ablation, or Rezum, which is thermal steam or water vapor. These procedures seek to ablate the prostate so that the donut hole can open up and men can urinate. It's in office, you can do it with an oral sedative, and there are sometimes fewer side effects than surgery. However, irritative symptoms, the urgency and frequency can be significant and last for months. Every patient requires a catheter afterwards, and there can be issues with sexual function. The long-term data for some of these older therapies, such as microwave and needle ablation, have not been shown to continue to be substantiated. Moving on to transurethral surgeries, there's 2 to 3 big categories of surgeries, but they're all fairly similar, and that includes TURP, or transurethral resection of the prostate, whether that's done with a button or a resection loop, and there's green light laser photovaporization, where a laser is utilized to either enucleate or to melt the tissue. You could even put HOLEP, or holmium enucleation of the prostate, into this category, as this is also removing tissue. They're all done transurethrally, and as you can see from the schematic, A telescoping camera is placed into the urethra, prostate, and bladder under anesthesia, and the tissue is more or less removed. TURP is the gold standard for removing tissue of the prostate. It's a good procedure and it can open up the prostate nicely, but it's not without its side effects. And that includes bleeding, ejaculatory issues, the need for a catheter as well as hospitalization, and rarely incontinence. It's a good procedure for the right person, but it can have side effects. For large prostates, greater than 80 grams, I recommend doing what we call a simple prostatectomy, or not so simple, but it's considered simple because it's not a cancer procedure. I use the Da Vinci robotic surgical system to make small incisions on the abdomen, go transabdominally to remove that very large obstructing prostate. It opens up the urinary flow very well, and I've helped men significantly, whether they're in urinary retention or with difficulty voiding. However, every person needs to be admitted to the hospital afterwards. It's approximately a 2-hour procedure done under anesthesia. There can be bleeding risk, and men have to wear a catheter for 10 to 14 days and limit their activity for up to 6 weeks. For men with difficulty with urination, who don't want to have a surgical procedure in the operating room, yet want to maximize their urinary flow and decrease their urinary symptoms, I recommend the Urolift system. It is a non-ablative, non-surgical procedure that can be done in the office of the operating room with no tissue destruction, no tissue ablation, that can preserve sexual function, preserve erections, ejaculation, and typically has rapid and durable relief. In fact, it has the quickest return to normal of all these procedures, and typically has no catheter. It does have some of the same disadvantages as every other surgical procedure for the prostate, including some discomfort, some mild bleeding, as well as some increased urgency after the procedure. I typically recommend men expect urinary urgency and frequency for the first 2 weeks. This is a schematic for how the Urolift system works. It is a non-ablative, non-tissue destroying procedure. Telescoping camera is placed within the urethra and the prostate. A needle is deployed, allowing the implant to hook on the outside of the prostate. Pressure is continuously applied to the urethral side of the prostate, and the urethral endpiece is deployed, opening up the prostate and creating a channel. Here's a quick video of how the Urolift system works. The telescoping camera is placed within the urethra. An implant is deployed, hooking on the outside of the prostate. Continuous pressure is applied and a urethral endpiece is placed on the urethral side of the prostate. This is done in a similar manner on the other side of the prostate. When both sides have adequate compression, a channel is achieved. On the left-hand side, you can see before and then after photos of a channel being opened, and here is the cystoscopic view of the channel being opened. Here is a cystoscopic view of the Urolift system at work. On the left-hand side, you can see an obstructing prostate, and on the right-hand side, the Urolift implants have pulled open the prostate to create a channel from what you can see at the bottom of the screen, the ejaculatory duct, to the distance, which is the bladder. The Urolift implant is composed of 3 pieces, which includes a nitinol capsular tab, a polypropylene suture, and a stainless steel urethral endpiece. So who gets what? Well, typically men start with medications or watchful waiting. Some men may jump straight to the Urolift as a first-line treatment. After the evaluation by the primary care and the urologist to rule out cancer and to make sure that the problem is adequately being addressed, and after cystoscopy, men will then move to a procedure or a surgical procedure. And those, as we mentioned, I typically will move to the Urolift as my second-line treatment, sometimes first-line, but after medications, my second-line treatment. If that is insufficient to treat men's symptoms, which is rare, I then typically will move to a green light laser or a transurethral resection of the prostate. For men with very large prostates, I will jump immediately to a robotic simple prostatectomy. This is a schematic of some of the treatments that I discussed here. All the treatments have benefit, all have some downside, but typically, in order to decrease the lower urinary tract symptoms, open up the prostate, yet while preserving sexual function and ejaculatory function, typically the Urolift will provide that while others will not. Yet for other men, some of the other treatments such as transurethral resection of the prostate or even simple prostatectomy are optimal depending on their anatomy and size of the prostate. This is a patient of mine that I performed a Urolift on 3 years ago. And as you can see in the top row, obstructing lateral lobes, and in the bottom row, the Urolift implants, holding open the prostate, creating a clear channel into the bladder, I'm happy to say that 3 years later, this man is still enjoying a high quality of life and has not suffered from his urinary symptoms since. These are some quotes from patients that I've treated over the last few years. Finally, I can play golf without having to stop to go to the bathroom. After Dr. Phillips performed the Urolift, all my urinary issues are gone. I don't get up at night anymore. My stream is stronger. It feels so much better. Dr. Phillips was an excellent doctor. I had no pain at all after my Urolift. The nurses are excellent and very polite. It is okay to call me to discuss my experience. I had a catheter and Dr. Phillips was able to fix me. If you're having issues with urination and suffering from BPH, I'd like you to know that I'm available for consultations both in telemedicine as well as face-to-face evaluation. And I recommend that you pay attention to your symptoms before your appointment so that I can help you find the right treatment at the right time and the right solution for you. And I want you to know that I'm here to help improve your quality of life. Thank you very much. Once again, my name is Jason Phillips. I work at Urology San Diego in Oceanside, California. You can find me at 760-295-9984 or at urology-sd.com. Thank you very much.